I am Dr. P.K. Raju. I'm professor and head of the Department of Orthopedics from Bangalore Medical College. Alignment of the implants is one of the most important aspects to get wonderful results in TKR, post-operative results, and the long-term survival. So with the conventional knee, with the evidence says that the alignment should be within 3 degrees of varus valgus alignment or within 1 or 2 degrees of flexion alignment. The same thing can be achieved with any other technology, but with the robotic technology, probably the alignment will be, the outliers will be very less, especially getting the alignment according to whatever alignment you feel like, the 3 types of alignment: mechanical alignment, kinematic alignment, and functional alignment. So what is important now is getting the functional alignment to the patient, because it depends on the morphology of the knee. Originally, patient might have had a varus knee. So if you keep it in mechanical alignment, then the patient will not have satisfied, may not be satisfied. So keeping the knee in the morphologically original alignment is very important. But mechanical alignment is time tested and it gives wonderful results. Depends. So conventionally, if a person is experienced, definitely he can reduce the outliers to within 1 degree. A highly experienced surgeon, even by conventional technology. Whereas with robotics, naturally it helps the surgeon to give a ideal mechanical alignment or any alignment you choose. So the mechanical alignment does work, and now it is we go with a functional alignment. Well, definitely with the surgical time, if you think of surgical time, the duration of surgery is definitely more compared to the conventional knee. For so many things, putting the pins or removing the pins or registration during surgery, all this definitely takes time. But we know a person who does robotic knee, at least he should have done the conventional knee, plenty of conventional knees. If a person is straight into the robotics and he completely relies on robotics, definitely the surgical time will be less, but with plenty of downsides. So a person who is well experienced with a conventional knee, and if he is assisted by robotics, he gives a better this thing, and even the surgical time gets reduced. With the evidence, it says that at least minimum of 7 to 40 knees would have been done, robotic knees would have been done by the surgeon to reduce the time from 40 minutes to 16 minutes. Definitely our TKR survivals. So, the survivals of TKR with the robotics or with the conventional knees. Robotics knee, when you are getting a precise alignment, precise positioning of the component, then the survivalship should be really good in the long term, which not many evidences are there till now, but survival should be good if the alignment is good and the positioning of the component is good. Conventional knees, it has been proved. Evidence says that any variation by 3 degrees in the varus valgus alignment or flexion extension alignment by 1 degree, the survival is 10 years. So 10-year survival is good with the conventional knee as well. But if you are getting a perfect alignment, precise component positioning, survivalship should be more than 15 to 20 years with the help of robotic knee.